first we'll be discussing about the histology of lung, followed by the histology of blood vessels. Okay, so that day during the lecture already I have explained about the histology of lung and the histology of blood vessels. Now it will be a revision, and after that directly we'll see the slides. Okay, now exactly under microscope what you have to identify for the histology of lung. Okay, for that first you have to understand this particular part. Okay, now for that do you remember the trachea which we have discussed previously? Trachea we have discussed, I have explained in that class. So the layers of the trachea, whatever we have studied, okay, it will be continuation of the layers of the trachea, but there will be some changes. Okay, now this structure is called as what? Anyone? Yes, who said? No, entire one. Yes, bronchial tree. It is also called as tracheobronchial tree. It is called as tracheobronchial tree. Okay. Now in case of tracheobronchial tree, as I said, two parts are there. One is the conducting part, another one is the respiratory part. Okay, so this part which you can see over here, this is the conducting part, this is the respiratory part. Okay, so please follow the parts of the tracheobronchial tree, starting from the trachea. After that, the bifurcation of the trachea into two principal bronchus. Okay, after that, these two principal bronchus, what happens? It will enter the lung. Once it enters the lung, then it is called as intrapulmonary bronchus. It is called as intrapulmonary bronchus. Okay, when it is entering the lung. Okay, so if you see the bronchus before entering the lung, okay, before entering the lung, at that time the structure of the trachea and the bronchus before entering the lung, it is almost same. Okay, it is similar to the trachea. Now once it is entering the lung, okay, it is called as intrapulmonary bronchus. After that, you can see it is dividing and redividing and becoming smaller. Okay, smaller means the diameter reduces. Can you see the diameter of this part? Can you see the diameter of this part? So what do you think? It is reducing. As a result, what will happen? The other structural changes are also taking place. Okay, so structural change will take place in the mucosal level, structural place will take place in the submucosal level, then in the cartilage level, then in the muscle layer level. Okay, so in all the levels the changes are taking place. So that you have to notice what are the different changes taking place. Now this particular part, this is the respiratory part. Okay, respiratory unit, where you can see the terminal bronchiole is there, and after that it will again divide to form the respiratory bronchiole. Now respiratory bronchiole is the smallest bronchiole. Jitna bhi bronchiole hota hai, among them the smallest one is the respiratory bronchiole. Now the respiratory bronchiole, as you can see, it is leading towards the alveolar duct. After that there will be alveolar sac, as you can see in the diagram, and then it will lead to the alveoli. Okay, now the alveoli which are there, it is divided from each other. One alveoli, another alveoli, divided from each other by interalveolar septum. Okay, that can also be seen under microscope, interalveolar septum. Okay, so we'll see what are the changes taking place as we are going downwards. Now the structure of the larger intrapulmonary bronchi, as I said, it is almost similar to the trachea. Okay, as the bronchi divides into smaller ones, different changes are taking place. Now what are the different changes? First of all, the cartilage. Now do you remember in trachea we have seen that C-shaped cartilages are there? How many C-shaped cartilages are present? Approximately 16 to 20 cartilages are there. जो ट्रेकिया होता है उसमें कितना कार्टिलेज होता है? अप्रोक्सीमेटली 16 to 20 C-shaped cartilages are present. ठीक है. Now in case of trachea it is C-shaped, but once you go into the intrapulmonary bronchus, at that time the tracheal rings are not continuous. It is in the form of broken plates. Continuous नहीं रहता है. It is in the form of broken plates. Means cartilage, cartilage, cartilage like this. Not continuous. Okay. Next, other changes which are taking place. For example, as I said, cartilages are in the form of broken plate. Next, the smooth muscle fibers. Okay, smooth muscle fibers increases. That means the number of smooth muscle fibers increases. In case of trachea, we have seen that C-shaped ring, posteriorly the smooth muscle fibers are there. that is called the trachealis muscle. But here in case of intrapulmonary bronchus, a complete circular layer is present, which is made up of smooth muscle cells. Okay, so these are the changes taking place. Next, as I have mentioned, first cartilage. In case of bronchi, it is not continuous, broken plates of cartilages are present. Next, if you see, the muscle cells in the bronchial wall increases. Okay, if you go to the bronchioles, the muscle cells are more. Next, due to the presence of these muscle cells in the bronchioles, it is having an important clinical significance, and that is called as asthma. In that case, what happens? There will be spasm in the smooth muscles of the bronchioles. As a result, the diameter will further reduce. Okay, after that, what will happen? Patient will feel difficulty in breathing, which oftenly it is associated with the asthma. Okay, at that time, I hope you have seen inhalers are taken. Okay, so inhaler में क्या रहता है? The composition which is present in any of the inhaler, it is nothing but the bronchodilator. Okay, bronchodilator. So what it will do, it will go and reduce the spasm which is taking place in the smooth muscles of the bronchioles. Okay, so it will reduce the spasm. As a result, what will happen? The normal diameter will be maintained. Once the normal diameter is maintained, then the patient can breathe easily. Next change is subepithelial lymphoid tissue. Okay, it increases as you are going downwards. The subepithelial lymphoid tissue increases. Okay, so it increases in the bronchi as the bronchi becomes smaller. Okay, subepithelial lymphoid tissue increases. Next, the glands which are there, that means the seromucous glands which are present in the submucosa. Okay, it also reduces. And if you go to the bronchioles, these particular glands, they are absent. Next, the lining epithelium also changes. Now, what are the changes taking place in the lining epithelium? We know that in trachea, the lining epithelium is pseudostratified ciliated columnar epithelium, or also called as respiratory epithelium. Okay? Next, if you go to the smaller one, first it will be simple ciliated columnar, then non-ciliated columnar, and finally cuboidal. So if you go to the respiratory bronchiole or terminal bronchiole, then what will be the lining epithelium? It is simple cuboidal epithelium. Okay. Next, once you enter the alveolar duct, and if you go to the alveoli, further changes are taking place in the lining epithelium, and then it becomes simple squamous cells or simple squamous epithelium. Okay, so these are the changes which are taking place. So in the trachea, we have seen respiratory epithelium, and once you go into the alveoli, okay, we are getting the simple squamous epithelium. So these are the changes taking place, okay, in the tracheobronchial tree. Now, what you have to know and what you have to identify is, first, when I will focus on this one, intrapulmonary bronchus, at that time you have to find out the pseudostratified ciliated columnar epithelium. Okay. Next, the terminal bronchiole is also seen. In the terminal bronchiole, you have to find out the simple cuboidal epithelium. Okay. And in case of alveoli, you have to find the simple squamous epithelium. Note it down today only during the slide, when you will see the slide. Okay. Next, here you can see the differences between the intrapulmonary bronchi and the bronchioles. Okay. If you remember the layers of the trachea, that will help you to understand. I don't know whether you have studied about the trachea or not. If you remember the layers of the trachea, at that time you can see there are some similarities, but the layers which are present, okay, it is not same as the trachea. Some differences are there. Do you remember the layers of trachea, anyone? क्या है पहला layer क्या है in case of trachea? So in case of trachea, first is the mucosa. In mucosa, we are getting the lining epithelium. Then lamina propria. Next, where we are getting the submucosal glands. What is the next? Okay. So these are the layers which we have discussed earlier in the last class, right? So in case of trachea, first mucosa is there, where we are getting the lining epithelium and lamina propria. Okay. Next, in the submucosal glands are there, followed by the cartilage and muscle layer. Not cartilage. You can't write only cartilage. Cartilage and muscle layer. इसका मतलब क्या? What is the meaning? The meaning is cartilage and the muscle, they are present in one single layer. Okay, cartilage and muscle, they are present in one single layer. That is the meaning of cartilage and muscle layer. And followed by the most external layer is the adventitia. Okay, that already we have discussed in the trachea. Now if you see the differences between the trachea and the intrapulmonary bronchus, what do you think? What are the differences? First, mucosa is there. ठीक है? After mucosa, see, one thing is added, that is the smooth muscle layer. Okay, why I am mentioning? Because this thing you have to identify under microscope, or else you will not understand intrapulmonary bronchus. कुछ समझ में नहीं आएगा. As I said, directly you can't compare with the trachea. Okay, trachea का layers already I have written over here. Okay, and the layers of the intrapulmonary bronchus, as you can see. तो first mucosa is there. तो mucosa में क्या रहता है? Mucosa will be same. Pseudostratified lining epithelium same रहेगा. Pseudostratified ciliated columnar epithelium along with the goblet cells that can be seen. Along with that lamina propria, see, same lamina propria, यहाँ भी same है. But after that, the next layer is smooth muscle layer. Spirally arranged smooth muscle fibers are present in case of intrapulmonary bronchus. ठीक है? Next, submucosa is there, loose connective tissue with seromucous glands. But here the number of glands are less as compared to the trachea. Because as I said, as you are going downwards, as you are going towards the alveoli, the number of glands will reduce. So the number of glands which we have seen in case of trachea, here it will be less. Okay. Next, submucosa के बाद क्या है? You can see cartilage layer is there. Now how the cartilage layer is oriented? Not C-shaped cartilage, but discontinuous plates of cartilages are there. This also you have to identify. Very important feature. Okay. So this is about the intrapulmonary bronchi. Next, about the bronchioles. So first, see, it's mentioned no cartilage, no seromucous gland. So whenever you will focus on the bronchioles, at that time what you have to see, whether cartilage is present or not. अगर cartilage नहीं है, that means directly it is bronchiole. ठीक है? Now in case of bronchiole, as I said, no cartilage, and in the mucosa you will not find any seromucous glands. ठीक है? Next, only 3 layers are there in the bronchioles. What are they? First you will be getting the mucosa, then a smooth muscle layer, and then the connective tissue layer. Okay? In the connective tissue, mainly we are getting the elastic fibers. जो bronchioles का connective tissue होता है उसमें elastic fibers रहता है. Okay? Next, depending on the diameter of the bronchioles, subdivision is done. As you can see, larger bronchiole, medium bronchiole, terminal bronchiole, and respiratory bronchiole. And respiratory bronchiole is the smallest one. जितना भी bronchiole होता है उसमें सबसे smallest कौन सा है? Respiratory bronchiole. The diameter is less than 0.5 millimeter. Okay. Next, can you observe? Have you observed another differences in the bronchioles? Have you observed in the lining epithelium? Just see the lining epithelium. Is it same? No. In case of larger bronchiole, ciliated pseudostratified columnar epithelium with goblet cell. Here also you can see simple ciliated columnar with goblet cell. But once you go to the terminal bronchiole, here you can see simple cuboidal cell. And here the goblet cell is replaced by Clara cells, or also called as cells of Clara. Okay, these are the changes taking place. The goblet cell you can't see in the terminal bronchiole, and same thing is repeated in the respiratory bronchiole. Only the difference is the diameter. Diameter is less in case of respiratory bronchiole. ठीक है? तो जो goblet cells था, that is completely replaced by cells of Clara. Now ये जो cells of Clara, these are very important. Okay, why they are important? Because they are also producing surfactant. they are also producing surfactant, okay, and that will prevent the collapse of the bronchiole whenever a person is breathing, okay. And this clara cells, whenever they are secreting the surfactant, okay, there is a biomarker and that is called as CC16. Okay, this is called as CC16. So whenever there is any damage to the lung, especially in the bronchioles, at that time this CC16 level in the blood is elevated. Okay, so with the help of the blood test, it can be identified whether there is any damage or not present inside in the lung. Okay, this is a marker, important marker to identify whether lungs are acting properly or not. Okay, I'll give an example. In case of liver, I hope you have heard about SGPT, SGOT, right? So similarly, in case of lung, it is CC16. In biochemistry, you will be studying all those things. It is a type of protein, CC16. ठीक है? In biochemistry, you will be studying all those things. इसका जो level है, अगर elevated है, that means lung में problem है. Damage हुआ है lung में, या तो inflammation हुआ है, या तो infection हुआ है. Okay? Like this, the diagnosis are done. Okay, now in case of bronchioles, so lining epithelium varies according to the bronchioles. Larger bronchiole, as you can see, ciliated, pseudostratified. Medium one, simple ciliated columnar with few goblet cell. And in case of smaller or terminal, simple cuboidal with cells of clara. Okay, these are the changes which are taking place in the bronchioles as you are going towards the alveoli, as we are going towards the smaller bronchiole. And which is the smallest bronchiole? Respiratory bronchiole is the smallest one. ठीक है, तो when you will see the slide under microscope, respiratory bronchiole कैसे identify करना है? Very easy, yes. Yeah, first of all, your diameter is very small, but another point is there. No. Cells of clara cannot be seen. Cells of clara दिखाई नहीं देता. Listen, जो respiratory bronchiole होता है, it leads towards the alveolar duct. Okay, जो respiratory bronchiole होता है, it will lead towards the alveolar duct, and alveolar duct से alveoli में opening होता है. So you have to find out that. Okay, so like this you can identify the respiratory bronchiole. Don't worry, we'll see all those things today. Next, clara cells, as I said, these are the non-ciliated cell. Max Clara, German anatomist who have discovered these cells. Okay, they are predominantly present in the terminal bronchioles. They replace the goblet cells in the terminal bronchioles, in the terminal as well as in the respiratory bronchioles also. It secretes surfactant that is called as protein, clara cell secretory protein. Okay, clara cell secretory protein, also called as CC16. Next, the smooth muscle layer. It is predominantly present in the wall of the bronchioles. So if you see the smooth muscle layer, okay, smooth muscle layer का जो thickness होता है in bronchioles, it is more thick as compared to the intrapulmonary bronchus. In intrapulmonary bronchus, smooth muscle layer is present, but उसका जो thickness है, that is less as compared to the smooth muscles which are present in the bronchioles. Okay, that also you have to identify under microscope. And lastly, the connective tissue. So as I said, in the connective tissue, rich elastic fibers are there, which helps in the elastic recoiling of the lung or recoiling of the lung. Okay. Next, respiratory bronchiole. So it is the smallest one. Diameter is less than 0.5 millimeter. Okay. The gaseous exchanges are taking place. If lining epithelium is simple cuboidal epithelium. Gradually cilia are not there. Smooth muscle cells are present around the epithelium. Okay. A delicate layer of connective tissue is also there, which is separating the bronchiole from the adjacent structure. And in the epithelial lining, along with the epithelial lining, the cells of clara are also seen. And respiratory bronchioles also see alveolar outpouchings, which will lead towards the alveoli. Now here is the diagram. Okay, very important schematic diagram. This you have to draw in the practical notebook. Okay, so what is this? This is the intrapulmonary bronchus, and what is this? Terminal bronchiole. So what do you think? What are the differences? Differences क्या है? What are the differences? What you can see? Yes, so see, first you have to identify one by one. So in case of intrapulmonary bronchus, as I said, how many layers are there? 4 layers are there. So we'll go one by one. So first layer is the mucosa. Mucosa में क्या देखना है पहले? Lining epithelium. So here you can see this is the lining epithelium. ये देखो, this is the lining epithelium. Okay. Now here you can see goblet cells are present. Can you see? These empty spaces, these are nothing but the goblet cells. Okay. Next, if you go deep to this, now this is nothing but the lamina propria. ये देखो, this is the lamina propria. ठीक है. Now outside of the lamina propria, can you see a small muscle layer? See, this is the muscle layer. Okay. So muscle layer is present, but the thickness is very less. If you go exterior to the muscle layer, then you can see this is the submucosa. Now in the submucosa you can see seromucous glands are there, but number of glands are less as compared to the trachea. ठीक है, ये देखो seromucous glands, ये seromucous glands. Okay, and if you go more outwards, then you can see the cartilage. So this is plate of cartilage, this is plate of cartilage, these are the plate of cartilages. Okay, so exact appearance you will see under microscope. ठीक है, so that you have to identify. Next, what is this? Terminal bronchiole. Now in terminal bronchiole, what you have to identify? First you will see whether cartilages are present or not. So is it present cartilage? No, cartilage is absent. ठीक है. Next, if you see the lining epithelium, ठीक है, उसके लिए 40x में zoom करना होगा. Then you can see that the lining epithelium यहाँ पे कौन सा होगा? Simple cuboidal epithelium, and goblet cells are absent. Instead of that, cells of Clara are present. Okay. Next you can see the muscle layer. ये देखो, this is the smooth muscle layer. Now this smooth muscle layer is thick as compared to this one. Okay, that means more number of smooth muscles are present. Okay, and if you go more outside, then you can see this is the this one, connective tissue layer. Connective tissue layer. Now here what you can see? This is the histology of lung. Under microscope, this appearance will be there. So here you can see the intrapulmonary bronchus. Can you see the intrapulmonary bronchus? Anyone? कहाँ पे है? Yes, this is the intrapulmonary bronchus. So one section of the intrapulmonary bronchus can be seen. Next, yes, what is this? Terminal bronchiole. What is this terminal bronchiole? ठीक है. Now can you see the smaller one? This is the respiratory bronchiole. ठीक है. See, this is the respiratory bronchiole. And as I said, respiratory bronchiole will always lead to the alveolar duct. ये देखो alveolar duct. Okay, and through alveolar duct it is going towards the alveoli. तो ये जो portions है वो empty portion, these are alveoli. These are alveoli. Okay, and these are the alveolar septum. ये देखो, these are the alveolar septum, separating the adjacent alveoli. Okay. Now here what you have to identify, mainly the simple squamous epithelium यहाँ पे. Okay, in the alveoli you have to identify the simple squamous epithelium. Another type of cells are also there, that is type 2 pneumocyte, but for that you need electron microscope. Okay, majority of them are type 1 pneumocyte, that is simple squamous epithelium in alveoli, and type 2 are there, only 5% population of the cell are the type 2 pneumocytes. And what is their main function? To produce surfactant, which will prevent the collapse of the alveoli. Okay, so two types of cells are there which are producing surfactant. One is the Clara cells or cells of Clara. Second is the type 2 pneumocytes. Okay, next here you can see the differences between the bronchus and the bronchiole. Okay, each and every layer is mentioned, and in each and every layer what are the differences you have to identify under microscope. It is mentioned over here. Okay. So this particular thing also you have to write in the practical notebook. ठीक है? This will help you during the time of exam. Okay, so you can do revision in 1 or 2 minutes. Entire bronchus and bronchiole you can do revision within 1 minute by looking at the differences. Okay, next about the alveoli. So these are the thin-walled polyhedral sac-like terminal air spaces, okay, of the respiratory system. Why alveoli are there? Especially for the gaseous exchange. In each lung, approximately 150 to 250 million of alveoli are present. Okay, and if you see the surface area, it is approximately 75 meters square. Okay, in one lung. Next, the size of the alveolus is approximately 200 micrometer in diameter. Now the adjacent alveoli are separated by a connective tissue septum, that is called as alveolar septum. Now in the alveolar septum, fibroblast, macrophages, such kind of cells are present. Okay. Next, interalveolar pores are also there. These are the opening of the alveolar septa, which helps to interconnect the adjacent alveoli. Okay, that is the interalveolar pores. Next, in the alveolar wall, two types of cells are there, type 1 pneumocytes and type 2 pneumocytes. 95% of the population are type 1 pneumocyte, and type 1 pneumocyte is nothing but the simple squamous epithelium. Okay, what is the function? Gaseous exchange. And these particular cells are placed together with the help of occluding junction. This is a type of cell junction. Okay, so type 2 pneumocytes only 5%. What is their function? They secrete cell surfactant. As you can see, they produce surfactant. Now, what is the name of the surfactant? Dipalmitol phosphatidyl choline, or also called as DPPC. Okay, this is the compound, or you can say composition of the surfactant which is produced by the type 2 pneumocytes. Now, type 2 pneumocytes are acting as progenitor of type 1 cell, production of surfactant. Okay, and along with that, Brush cells are also there. Okay, which are nothing but the monitoring cells, which will monitor what type of air is going into the alveoli. Okay, now starting from the trachea, in the lower respiratory tract, starting from the trachea to alveoli, what are the different types of cells present in the lower respiratory tract? The list is given over here along with the function. Okay, so see, first in the lining epithelium we are having the ciliated cell, then goblet cell, basal cell, granule cell, Brush cells, and cells of Clara. Okay, and see the functions, whatever the functions they are having. Next, in case of alveoli, type 1 and type 2 pneumocytes are there, and along with that, Brush cells are also present. Okay, so this chart is also important. I will request everyone to include this chart in the practical notebook. Okay, along with that, a diagram is also there showing all the different types of cells. This one I have seen most of the students have drawn. If you have not drawn till now, please draw the diagram. This one. Okay, here you can see all the cells present in the respiratory tract. Which part of the respiratory tract? Lower respiratory tract. And we have discussed about each and every type of cell along with its function. Okay? So that is all about the lung. Next, we'll discuss about the blood vessels. Mention about this, Clara cell secretes surface active protein agent, that is called as Clara cell secretory protein, or also called as CC16. Okay? So Clara cell protein are used as a marker for lung injury. That means if there is any damage to the lung, inflammation, infection, anything, at that time what will happen? This particular will be elevated. This particular protein will be elevated in the blood. So like this, the diagnosis can be done. Okay. Next, in the blood vessel. In the blood vessel, what you have to know, first of all, if you take any blood vessel. Okay. Now, before going to the blood vessel, let me show you one thing. Now, this is the flow chart by which you can see how the blood is flowing in our body. Starting from the heart, again going back to the heart. Okay. This flow chart is also important. So you don't have to write this flowchart in your practical notebook, but whenever you are studying, okay, at that time it will be better if you write the flowchart. Okay, so from the heart, how it is coming out and how it is going into the heart, back into the heart. Okay, already I have shown you in the lecture hall that day. Next, if you take any blood vessel in our body, okay, basic 3 layers are present. 3 basic layers are present in any of the blood vessel. Doesn't matter whether it is artery, whether it is vein, whether it is venule, arteriole, कोई भी हो, ये तीनों basic layer रहेगा. Now there will be some changes on those basic layers. Some will be thicker, some will be thin. Okay, those changes will be there, but these 3 basic layers are present. So what are these 3 basic layers? First of all, tunica intima is there, tunica media and tunica adventitia. These are the 3 basic layers. Okay. Now the meaning of tunica is coat. Now ये जो 3 layers है, whatever I have mentioned just now, Now what are present in those three layers? So first you can see in case of tunica intima, this is the innermost layer, this is the middle layer, and this is the outermost layer. Okay. So in the innermost layer, first lining epithelium is present. Now what is the lining epithelium? Is the endothelium. Now what is endothelium? It is nothing but the simple squamous epithelium. Endothelium is the example of simple squamous epithelium. Mesothelium, where it is present? Yes. Peritoneum covering. See, no discussion. I hope you have heard about serous membrane. ठीक है, तो जहां पे ये serous membrane रहेगा, those are lined by mesothelium cell. Okay, the main function is production of the thin film fluid which is present between the two layers of the serous membrane. Serous membrane का दो layer रहता है. What are they? Parietal layer and visceral layer. Visceral layer is the innermost layer, parietal layer is the outer layer. ठीक है, दोनों के बीच में thin film fluid रहता है, that is secreted by the mesothelium. Okay, mesothelium is also an example of simple squamous epithelium. Okay. Now endothelium example is simple squamous epithelium. Next, just below the endothelium, okay, what is present? Subendothelial connective tissue is there, which is a loose connective tissue. Okay. Now one important thing, please note that ये जो endothelium रहता है, now this endothelium which is present in the lumen of the blood vessel, they always lie parallel to the flow of the blood. They are lying parallel to the flow of the blood. Okay, suppose एक blood vessel है, blood vessel के जो lumen है, in that we are getting the endothelium. Now they are lying always parallel to the flow of the blood, or else what will happen? They will provide resistance to the flow of the blood. Okay. Endothelium क्यों रहता है? Why the endothelium is present? Why other cells are not there? Cuboidal or columnar, why it is not there? So whenever we will see any blood vessel, okay, if you focus on the lumen of the blood vessel, the lining epithelium is endothelium, which is nothing but the simple squamous epithelium. And as I said, this simple squamous epithelium is lying parallel to the flow of the blood. You can see the flow of the blood, it is lying parallel to it. Okay. Why? Because the blood can flow easily. If it is not lying parallel to it, then what will happen? This particular cells will provide resistance to the flow of the blood. Next question is why simple squamous epithelium is present? Why not cuboidal? Why not columnar? Because they are having large surface area. Okay, and on that surface they don't have any cilia, any microvilli, nothing. Okay, that's why large surface area, smooth area, easily blood or other fluid can flow. That's why simple squamous epithelium is present. Okay, same in case of lung also. In the alveoli, why simple squamous epithelium is there? Large surface area hai. Okay, so the gaseous exchange can take place easily. If you take the example of a cuboidal and columnar, उसमें large surface area नहीं मिलेगा. But in case of squamous epithelium, you are getting large surface area as compared to those cells. That's why simple squamous is present in case of lung or in this particular area where large surface areas are required. Okay. Don't know what you have studied in epithelial chapter, epithelium tissue. So in case of tunica intima, as I said, endothelium. In endothelium, what is there? Simple squamous epithelium. Just below it, subendothelial connective tissue is present. Okay? And internal elastic lamina is also present. Now what is this internal elastic lamina? Where the subendothelial connective tissue. What is the meaning of subendothelial? Below the endothelium. जो connective tissue रहता है, that is subendothelial connective tissue. Okay? Now, where the subendothelial connective tissue ends, in that particular part we are getting the internal elastic lamina. Now how it is formed? It is formed by the fenestrated elastic sheets. That means elastic fibers together, they will form sheets of elastic fibers. Okay, they are fenestrated. Fenestrated means small or tiny microscopic pores are present. Okay, these are called as fenestrated elastic sheets. So they are present just below the subendothelial connective tissue, okay, and which is forming the internal elastic lamina. Below internal elastic lamina, the tunica media starts. So in the tunica media, mostly we are having the smooth muscle fibers and fenestrated elastic sheets, depending on the which type of artery we are studying. Okay, either smooth muscle will be dominant or elastic fibers will be dominant. Now where the tunica media ends, in that particular part also external elastic lamina is present, nothing but the elastic fibers which are present in the form of sheets. ठीक है. Next, जहाँ पे elastic lamina खत्म होता है, external elastic lamina, from there we are getting the tunica adventitia. Okay, tunica adventitia. In tunica adventitia, mainly collagen fibers, elastic fibers are there, and along with that fibroblast cells are also present. Okay, now always keep that in mind, जहाँ पे ये collagen fibers, elastic fibers है, in that part fibroblast cells will be there, because these cells are the precursor, or you can say they are only producing this particular fibers. That's why these particular cells will always be there. ठीक है. Now along with that, in the blood vessel, mainly in case of arteries, we can see vasa vasorum and nervi vasorum. Okay, now what is this vasa vasorum and nervi vasorum? Anyone? Any idea? Yes. Bolo. You should interact. Bolo. See, I'll give you example. Very good example. I hope you have seen the heart. Heart तो सबने देखा है in the dissection hall. Okay. Have you seen the coronary arteries? क्या function है coronary artery का? Provide blood supply to heart. But we know that heart is providing blood supply to our body. Then what is the function of coronary artery? Heart is pumping blood to the entire part of the body, various part of the body, right? तो coronary artery का function क्या है? Provide blood to the heart. क्यों? heart में तो blood है, heart ही pump कर रहा है blood. Then why heart needs blood? Yes. ठीक है. तो सेम कॉन्सेप्ट इज फॉर दिस वन. तो क्या होगा? व्हाट डू यू थिंक? जो ब्लड वेसल्स है, ठीक है, यस, तो जो ब्लड वेसल्स है, हाउ मेनी लेयर्स आर देयर? 3 लेयर्स आर देयर. तो जो अंदर का जो लेयर्स है, दे आर गेटिंग ब्लड फ्रॉम द लुमेन ऑफ द ब्लड वेसल. ओके, बट जो आउटर पार्ट है, दे आर नॉट गेटिंग ब्लड फ्रॉम द लुमेन. तो वो कहाँ से मिलेगा? फॉर दैट द vasa vasorum are there. They are arising from the interior, and then they will go and supply the exterior of the blood vessel. Okay, can you see the vasa vasorum? ये देखो. Next, here you can see this is a 3D diagram. This you don't have to draw in practical notebook. This is for your understanding. This is a 3D diagram where you can see all 3 layers of the blood vessel. ठीक है. First you can see the tunica intima, the innermost layer. Okay, you can see the endothelium, you can see the basal lamina, then you can see the subendothelial connective tissue. ठीक है. Next you can see the tunica media, where smooth muscle cells and elastic lamellae, that means elastic fibers in the form of sheets, are present. Okay, and then you can see the external elastic lamina also. You can see the external elastic lamina. Okay, the outermost is the tunica adventitia. यहाँ पे क्या रहता है? mainly collagen fibers and elastic fibers are present. Okay, now first we'll see about the arteries, that means the microscopic structure of artery. Okay, in artery we'll categorize into 2 parts, that is the muscular artery and elastic artery. Okay, and in case of veins also we'll do the classification based on the diameter, and then we'll study the internal structure. So as I said, first we'll start with the artery. So in case of artery, the first artery which we are going to study, that is the elastic artery, also called as large artery. This is nothing but the conducting vessels. Okay, these are the conducting vessels. What is the meaning of conducting vessel? For example, heart is there. From heart, the blood is taken out, so it is conducted to the other parts. That is the conducting blood vessel or conducting arteries. Okay, for example, carotid artery, subclavian artery. Okay, these are nothing but the examples of conducting blood vessel. Next, another type of blood vessels are there which will distribute that blood to a particular area, to a particular region, or to a particular organ. These are called as distributing arteries. Example, femoral artery. Femoral artery कहाँ पे रहता है? Femoral artery, lower limb. So it is distributing blood to lower limb. This is the example of distributing blood vessel. Okay, so like these two types of arteries are there. I am not telling only two other types are also there. Okay, but here we are going to study about these two arteries only. Now in case of elastic artery, see again these three layers are present, that is the tunica intima, tunica media and tunica adventitia. ये तीनों layer रहता है. Okay, now what are the differences? First, here endothelium will be there, subendothelial connective tissue. Next, internal elastic lamina is present, but it is not prominent. Okay, internal elastic lamina is present over here, but it is not prominent. That means it will be very difficult to identify the internal elastic lamina in case of elastic artery. It is present, but it is not prominent. Okay. Next, if you see the tunica media, though it is elastic artery, that's why what will happen? Smooth muscle fibers are less in compared to that. Multiple layers of fenestrated elastic lamellae are there. That means more number of sheets of elastic fibers are present as compared to the smooth muscle cells or as compared to the smooth muscle fibers. Okay, in case of the elastic artery. Next, if you see the thickness of the tunica media, over here it is thickest. The tunica media is thickest in between these three layers. Next is the tunica adventitia. It is relatively thin and longitudinal collagen fibers are only present. Okay, so if you see the elastic artery, जो tunica adventitia है, it is very thin and only made up of longitudinal bundles of collagen fibers. Okay, here is the diagram. Now in this diagram, can you see what is this? ये क्या है? Tunica intima. Okay, where you can see this is the lining epithelium. ये देखो, this is the lining epithelium. Okay, now below lining epithelium, this is the subendothelial connective tissue. ये देखो, this is the subendothelial connective tissue. Okay, now where the subendothelial connective tissue ends, in this particular part there should be the internal elastic lamina, but as I said, it is not prominent. रहता है, but it is not prominent. That's why it is very difficult to see. Okay, next, this entire thickness is made up of tunica media. ये देखो. Okay, now in tunica media two things are there. What are they? First, there will be sheets of elastic fibers. In between the sheets of elastic fibers, you can see smooth muscle fibers that you have to identify in the elastic artery. So can you see these are the sheets of elastic fibers? ये देखो, and these are the smooth muscle fibers. Okay, so in smooth muscle fibers, wherever the nucleus can be seen, this is nothing but the smooth muscle fibers. Okay, और जब ऐसे longitudinal lines दिखाई देगा, these are nothing but the elastic fibers. Okay, so as you can see, these are the elastic fibers and in between them you can see the smooth muscle fibers. Okay, so यहाँ पे the number of elastic fibers are more as compared to the smooth muscle fibers. Okay, and you can see the thickness of the tunica media, it is the thickest. Next, if you see this small thin layer is nothing but the tunica adventitia. Okay, where mainly longitudinal collagen fibers are present. Okay, now whenever the slides are prepared, as I have seen in most of the cases, not all, most of the cases, ये जो tunica adventitia है, okay, it used to get separated from the tunica media. In most of the cases, as I said, it will get separated from the tunica media. That's why it can be identified very easily. Okay. So previous one was schematic diagram. Now this is the histological diagram where this is in low magnification, this is in high magnification. Okay. So what you have to identify? First, you can see this is the tunica intima where the lining epithelium can be seen. See, this is the lining epithelium. Okay. After that, this is the subendothelial connective tissue, ये वाला part. Okay. Then you can see this entire part is the tunica media. Okay, and this is the tunica adventitia. So see, some part of the tunica adventitia got separated from the tunica media. Okay, during the processing of the slide. That's why in case of elastic artery, ये identify करना बहुत easy होता है tunica adventitia. Next is the muscular artery or medium-sized artery. These are also called as distributing blood vessels, which will distribute blood to the various part of the body. Now here also again three layers are there, but what are the difference? As you can see, endothelium is present. Endothelium सब में रहेगा, compulsory है, ठीक है. After that, the subendothelial connective tissue is present, but it is very less as compared to the elastic artery. Okay. नेक्स्ट प्रोमिनेंट इंटरनल इलास्टिक लेमिना इज प्रेजेंट. दैट मीन्स यहाँ पे जो इंटरनल इलास्टिक लेमिना है दिस विल बी प्रोमिनेंट. दैट मीन्स इट शुड बी आइडेंटिफाइड. एंड बिलो द इंटरनल इलास्टिक लेमिना व्हाट इज प्रेजेंट? टुनिका मीडिया. Now here the tunica media is a bit thicker but not as thick as the elastic artery. More smooth muscle fibers are there because see this is muscular artery. That's why less number of elastic fibers are there, more number of smooth muscle fibers are present. Okay. In case of tunica adventitia it is relatively thick, not thin like the elastic artery. यहाँ पे जो tunica adventitia है इसका thickness ज़्यादा होता है. It is more. Okay. Relatively thicker, and here also you are getting the vasovasorum, nervi vasorum, etc. And in case of tunica adventitia elastic arteries, okay, it is thicker as compared to the elastic artery. Now here you can see the diagram. तो ये देखो, this is the endothelium, this is the tunica intima. Now here subendothelial connective tissue is present but it is very less. ठीक है. Next you can see this is the tunica media. This part is tunica media where plenty of smooth muscle fibers can be seen. Okay, and then this is the tunica adventitia. Okay, thus us see the thickness of the tunica adventitia. It is more as compared to the elastic artery. Okay, so like this you have to identify under microscope. Okay, this is the original histological diagram. Okay, ignore this part. This is for medium sized vein. So you can see the tunica intima. Then see this is the tunica media. And this is the tunica externa, or you can say tunica adventitia. Okay. What is this? Comparison, or you can say differences between the elastic artery and muscular artery. So all the points whatever we have discussed, everything is mentioned according to the layers. So what are the changes in tunica intima, in media, in adventitia? It is given in both the cases, elastic artery as well as in the muscular artery, followed by the examples. Here you can see these are the examples. As I said, subclavian artery, carotid artery, aorta, these are the elastic artery. Okay, muscular artery का example क्या है? Brachial artery, femoral artery, etc. Okay, so whenever you are studying, please study the examples also. Okay, because during the time of practical exam, examples will be asked. Okay. So that is all about the arteries. Next part is veins. Now in case of veins it is classified based on the diameter. First venule, smallest one, then small vein, medium sized vein and the large vein. Okay, this is how the classification is done based on the diameter. Now venules and small veins, these are the smallest veins. Okay, these are called venules. Now what is the function? First of all, they will collect the blood from the capillaries, and the wall of the venules have considerable permeability. Why? Because they allows the gaseous exchange or any other type of exchange which are taking place. Okay, to the surrounding tissues. Next, the venules are the sites where lymphocytes and other particles can go into the bloodstream or can come out from the bloodstream to the surrounding tissue because of the permeability. And the diameter, as you can see, in case of venule it is less than 1 millimeter. Now in case of venule also, again two types are there. This is the post capillary venule and muscular venule. These are nothing but the division done based on the diameter. Next, in case of large vein and medium sized vein, तो main difference क्या होता है large and medium sized vein में? First of all, diameter will be different. Next, in case of large vein, all three layers, that means tunica, intima, media and adventitia, can be differentiated easily. Any large vein. Where in case of medium sized vein, those three layers are present, but you cannot distinguish between all three layers. Okay. Next, in case of large vein, what happens? If you see the tunica adventitia, it is more thick as compared to the tunica media. That is the important identifying feature for the large size vein. So see, in case of a large size vein, the tunica adventitia is always thicker than the tunica media, which was opposite in the artery. Now walls of the large vein have some elastic tissue which resists the pressure. Okay, The examples are inferior vena cava, superior vena cava, etc. These are the examples of large vein. Medium sized vein में क्या होता है? They are also having all the layers, but it is difficult to identify or difficult to distinguish. Now, what are the examples of the medium sized vein? Splenic vein, testicular vein, etc. Now, in case of medium sized vein, the diameter remains 1 to 10 millimeter. Okay. Tunica intima consists of endothelium, basal lamina, subendothelial connective tissue. Next, internal elastic lamina is there, but it is discontinuous. Plates of internal elastic lamina are present, not continuous like the arteries. Tunica media are thin and consists of few layers of smooth muscle only. Okay, so here tunica media is very thin and only few layers of smooth muscles are present. Elastic fibers are not there. Next, in case of tunica adventitia, it is thick connective tissue containing collagen fibers and elastic fibers. Okay, so this is the importance, and you can say this is the difference. In case of tunica adventitia, it is thicker, mainly collagen fibers and elastic fibers are present. Okay, now what will be the example of medium sized vein? Popliteal vein, tibial vein, etc. Okay, next, another important point is there which is related to the medium sized vein, that is the presence of valves inside the vein. Okay, now I hope you have studied about the venous drainage of lower limb. So how many sets of veins are there, different types of veins are there in lower limb? Yes, 3 sets are there. Name them. Deep vein, superficial and perforating. Okay, so you have studied that valves are present. If there is any incompetency of the valve, then what the condition is called as? Varicose vein. Very good. You have studied about the varicose vein. Okay, so same thing, that valve which you have studied, it is present inside the medium sized veins. Okay, so as you can see, venous valves are more present in the lower limb because they supports the column of blood which is required to flow the blood in opposite to the gravity. Okay, now here you can see the medium sized vein. So in medium sized vein, first of all, this is the endothelium. See, this is the endothelium. Now after endothelium, if you see the tunica media, it is very thin, only few layers of smooth muscle cells are present. Okay, and after that you can see the tunica adventitia, which is quite thicker, where bundles of collagen fibers and elastic fibers are present. Next, you can see the valves, okay, which are present. So already you have studied about the valves of the lower limb. Same thing. Next, this is the large size vein. Okay, in large size vein, as you can see, all 3 layers will be there. Okay, so first endothelium, basal lamina, subendothelial connective tissue, everything is present. Tunica media is relatively thin. You can see tunica media is relatively thin. Few smooth muscle cells, fibroblasts and collagen fibers are present. And in case of tunica adventitia, you can see bundles of smooth muscle fibers. You can see these are the cut sections of the bundles of smooth muscles. Large vein में रहता है. And along with that, you can also see collagen fibers and fibroblast. Okay, so you see longitudinal bundles of smooth muscles are present in the tunica adventitia of a large vein. Okay, so that is all about the veins. So today we have discussed, after lung we have discussed about the arteries and about the veins also. Okay, as I said, all 3 layers will be there, but there will be some changes in case of arteries also, in case of veins also. Okay.